Welcome to the Horder Centre, part of Horder Healthcare. Our vision is to be a leading provider of high-quality healthcare services, improving patients' health and striving to make a positive difference to people's lives. The Horder Centre is located in the Ashdown Forest and is an orthopaedic centre of excellence, delivering high-quality outcomes of surgery and advanced physiotherapy in a therapeutic environment, providing a great place to work, practice medicine and receive care. The values of our organisation of being friendly, caring, having pride and integrity and believing in the quality we provide form the basis of our everyday working lives here. I'm proud to report that 98% of our patients continually tell us that their experience has been excellent and they would happily recommend us to their friends and family. So welcome to the Horder Centre. Please come in and meet some of the key members of staff that you may come across should you choose to have surgery or indeed visit us in the future.
When you arrive at the Horder Centre, a volunteer will greet you and help you with your bags to the reception desk. Once you are checked in, another volunteer will then take you and any family or friends you have with you down to our Day Services Unit known as a DSU. At the Day Services Unit you will be met by a ward clerk who will help you with the rest of your journey.
When the patients arrive, they are generally seen by one of our clinical support workers, who are shown to a seat to be seen by the pre-assessment team individually. Prior to surgery, all our patients are monitored for their blood pressure, height and weight. Sometimes they need to see the anaesthetist and they will have an ECG, which is an echocardiogram. That's just to check that heart is working at its proper rhythm.
If you're having a hip or knee replacement done with us, at the pre-assessment stage you will attend a joint school. Within joint school, a member of the therapy team will advise you on preparing for surgery, what to expect during your initial recovery and how to manage following your discharge. Therapists are available following joint school to discuss any individual concerns you may have.
On the morning of the surgery, patients are asked to bring with them their dressing gown and slippers, their toilet bag, all the medication. They can bring anything in with them like their iPad, book, biscuits, juices that they can always have after their surgery.
Before surgery, all our patients walk to the operating department from the Day Services Unit, which is not far away from here along the corridor. The first place you're looked after in the operating department is in the anaesthetic room, and then we verify the patient's consent with them again to make sure that they're still happy to go ahead with the procedure and they don't have any more questions that they want to ask either of us or of the surgeon who's doing the case. Once the consultant anaesthetist and his support team have put the patient to sleep and everything's safe and ready to go, we move the patient from the anaesthetic room into the operating theatre, then surgery can get underway. Once the operation has taken place, the whole theatre team with the consultant anaesthetist and the consultant surgeon supervise the safe transfer of the patient from the operating theatre to our recovery unit, which is just next door. And once the patient is very clearly wide awake and able to look after themselves and is happy themselves to go back to the ward, we ring the ward and then transfer the patient back up to their own room.
Following your procedure, when the theatre recovery staff deem that you're ready, you'll return to Dufferin Ward, where you'll be greeted by the nursing team looking after you. On the ward, you'll have your own individual room with an ensuite bathroom. It is important that we make regular clinical observations once you're back on the ward to ensure that you make a good recovery. Initially, these will be every half an hour, but then decrease throughout your stay. The tests and observations include such things as temperature, pulse, blood pressure, and your oxygen levels. Early mobilisation is key to enhancing your recovery, so once you've managed to have something to eat and drink and are medically well enough to do so, the team on the ward will assist you to get out of bed. This is normally on the day of surgery. The team on Dufferin are here to assist your recovery. We recognise that all our patients have individual needs, so please speak to the staff to establish your care and rehabilitation plans, and please feel free to raise any concerns you may have.
The food is prepared freshly every day by our team of chefs. We use a bakery from Sussex, local supplier for our bread, bakery that bakes freshly every day. It's all local. The fruit and veg is sourced from a supplier in Crowborough. You can expect freshly made soups, hot main courses, salads, everything and anything that you'd want to eat to make you better, basically.
Whilst on Dufferin, you'll be cared for by a range of staff. Please see our guides on uniforms to familiarise yourself with the different members of the team. On a daily basis, you'll be allocated a registered nurse, healthcare assistant and physiotherapist. please see your educational guides for advice on physiotherapy and exercises. You need to begin your exercises on the day of surgery, and your physiotherapy sessions will begin the day after your surgery. You'll normally receive 2 sessions a day, and these will consist of both individual and group sessions.
One of the main reasons why we do like patients to come to the gym is for education purposes. We're very keen that patients are well informed about the surgery that they've had done and what to expect afterwards. We have a therapy garden. You coping okay with that? You sure? Sun's beautiful, isn't it? We've got different surfaces that patients can practice walking on. We've got concrete, gravel, stones. We have a curb which has been created so that patients can simulate going up and down a curb. We have a small slope and we have a set of parallel bars. Not too much weight on the bars. That's lovely and wonderful. Nice.
When you're ready to go home, you'll be assessed by a nurse, physiotherapist and a doctor to ensure you're deemed medically fit and have met your physiotherapy goals to enable you to manage at home. Once at home, please continue to use the advice booklets we provide, and if you're unsure about anything at any time, you're more than welcome to contact the ward by telephone with any aftercare concerns.
My experience was very good at the Horder Centre. I got to about 70 years old and was told that I needed a new knee joint. And having never been in hospital for all those years, deep worry set in. But I spoke to the surgeon here. He put my mind at rest. I had the operation, which was very successful, and the aftercare was superb. After my operation, they were looking for volunteers, and I went down into the car park as a volunteer there. I've met some great people from all walks of life. I've had some good laughs with them. Really enjoyed my volunteering at the Horder Centre.